am doing injection sclerotherapy for the treatment of piles. It is a very simple procedure, no admission required. It's a painless procedure, and effectivity of this procedure is more than 90%, but mostly used in the second degree piles. Which solution we used? We are using in our hospital 5% phenol in almond oil. Now we are briefly describing about hemorrhoids or piles. Hemorrhoids mean splash in the pen. That means profuse painless bleeding is the pathognomic of piles. Color of the blood is bright red. Color of blood indicate the blood coming from rectum, not from lower GIT. If blood color coffee color or black, that means this is melena, not bleeding piles. Bleeding pile is a very common problem in patient. Causes faulty feeding habit. If patient having taking lack of water, low fiber diet, history of constipation, and straining during passing stool. That is the main etiology of piles. But secondary piles also occur. If piles is present, secondary, it indicates maybe there is a colonic or rectal pathology present. So if we are having facility, before doing pile surgery, it is mandatory to do colonoscopy to exclude rectal or colonic pathology, because secondary piles also present. But bleeding piles is a very troublesome condition. Regular bleeding through anus causing weakness and anemia to the patient. So it is very important procedure, the painless procedure. It is also called office procedure for treatment of piles. But limitation of injection sclerotherapy is it is only effective in second degree piles. Main point is that where we inject solution we are using 5% phenol in almond oil, and where we inject 1 ml solution 1 ml solution injected at the base of pedicle there. This sclerotherapy causing fibrosis and cut off the blood supply of the second degree piles, and after some times necrose piles slough off. What is the disadvantage of injection sclerotherapy? It is not effective in third degree piles where fibrosis already established, and piles, there are 3 grade of piles, 4 grade. Grade 1 only bleeding PR present. Grade 2 where bleeding along with the protrusion of the piles during defecation, and after defecation spontaneously go back. Piles go back in the rectum. Grade 3 bleeding, prolapse of piles, but patient required manually reposition. So always take history कि भैया ये आपका जो मस्सा है वो बाहर निकलता है, और निकलता है तो अपने आप अंदर जाता है कि उसको उंगली से अंदर करना पड़ता है. अगर दिस इज कॉल्ड सेकेंड डिग्री पाइल्स. इफ पाइल्स रिमेन्स outside from the anal canal, it is considered grade 3, grade 4 piles. It requires open hemorrhectomy. We are doing surgery for hemorrhectomy. It is called Milligan-Morgan hemorrhectomy. But today I am going to do injection sclerotherapy. Is the office procedure, painless procedure, no requirement of the admission. The duration of the procedure only 5 minutes. Thank you.